Happy Sunday, everybody. Hope everybody had a good weekend. All I've been hearing about is Dune, right? I'm curious to know if anybody has watched Dune this weekend. So I'll be curious to see what opinions are. Hi, Joyce. I'm not sure. I'm not sure if I came in late on this conversation or, and let me know if you can hear me. I'm always so nervous about my audio. Anyway, I plan on trying to go see Dune this weekend. So we'll see. We'll see if it lives up to the hype. I've certainly that's all that has been on every feed of every social media platform that I'm on. TikTok, YouTube, Instagram, all of them. Just continuous Dune commentary. But anyway, so today can't hear you. Okay. Let's see. Hmm. Right. Let's see. I'm just checking my. Is that a little better? Straight. Can't hear you. All right, let me see if I can. Let's see. Turn up the volume. Bear with me, guys. Really sorry about this. It might be. Let's see. Is that a little better at all? Because it's showing that it's a little stronger on my end. You'll hear the dog barking. Let's see. I'm trying to think of what else I can do. Yes, you can hear me now, Joyce? Or you chiming in on Tom's strange effects? It sounds like a special effect. Voice seems out of sync. Okay. Yeah. Um, okay, let's try one other thing. How's that? Is that better at all? You agree with Tom? I messed around with my audio on my microphone before. One other thing, let me try. Let's see. Okay, that's right. That's it. Let's try doing this. Okay. Well, mm, this is a group effort, my live stream, but I don't know. I was gonna use my a regular microphone before, and I was messing around with the audio. So there always has to be something wrong with my live stream. Uh, always something wrong. Let's see. I learned about you watching videos. Yeah, yeah. And I actually plan on doing a few more. My brain is out of sync, so let me know if the audio just is super annoying and I might. That's so strange. I don't know what the heck's going on. I am so technically challenged, but all of my settings are okay. Um, I'm trying to think of what else to do here. Um, Tell me, is that any better? Seems okay here in Chicago. Hey, Brian. I'm glad it seems okay in Chicago. I can't quite figure out what's going on in New Jersey here. Um, I can make out most of your words. All right. Well, we're just going to kind of go with it and wing it, and hopefully it's not too annoying. And then I'll see if I can fix it for the next live stream. Hopefully you can all stick with me and hear me well enough that it's not too distracting. Anyway, so tonight is all about Q&A. Pretty much open forum within reason. I actually thought twice about when I put that on the community post, but I want to get to know all of you just as much. So ask anything, tell me about yourselves. Hello to Brian, hello to Tom, Joyce. You're my ride or die. You're always with me, so I'm happy to hear from you as well. How's the weather in Chicago? Is it really cold? Because here it's been flirting with spring. We've had weirdly warm weather, but the last time I was in Chicago, it was I want to say February of 22. Warm and windy. Yeah, that's kind of how it is here. February of 22, it was so cold that we threw water up in the air outside, and it pretty much almost seemed to freeze midair. I've never been so cold in my life. And what company sends 200 employees to a sales meeting in February in Chicago? Amgen. Amgen does. That's 70 there today. Joyce, remind me where you are. I'm trying to remember. I think you told me one time or another. Has been really, really, yeah. So, is it global warming? I don't know. I don't know. I mean, it's been unseasoned. We had a bunch of snow last 2 weeks ago. We got hit with a foot of snow. I still have snow on the ground here. Um, Indy. Okay. Yeah, we still have pockets of snow on the ground, but the past few days it's been like flirting between 50 and 60. Global weirding. Yeah, I'm with you there. I can't quite figure out, is it something that's real or, you know, I'm sure I could find arguments for both sides, but all right. So hopefully we get some. some more good weather this week. I'm not even sure what it's supposed to be like, but so ask me questions. Who wants to know what? Otherwise I'll just start talking, and I don't know if you want me to do that. What can I start with? Um, all right. So I've been a nurse for 30 plus years. Uh, I have a birthday coming up this week too. So true Pisces here. And my experience goes between operating room, ER, critical care, neurology, immunology, autoimmune. So that's why I decided to start lucidmed when I was having the same conversations repeatedly with my patients, which was centered around IVIG. What it was, is it a synthetic drug? Is no, not many people know that it's a blood product. So I was watching YouTube one day, basically, and all of the videos that I was pulling up just to see what was out there as far as information on IVIG, I wasn't finding much. And what I was finding was either really, really super boring or, way over the heads of most people, sometimes even me, when they were interviewing neurologists and things like that. So kind of looked at it and thought, I can, I can do this. I can do better than that. And I started the channel with the IVIG series, which was okay. For my first go around, I had my iPhone camera and that was it. And I recorded that series. And then from there it snowballed because people wanted to know more about chronic illnesses, diseases, had a lot of questions about them. So I started by just picking topics out of a hat and just recording. Let's see. I know you can't make any specific things, but are there vitamins or herbs that might help high blood pressure? Um, so the blood pressure situation, I know that there was a lot of talk about niacin, and I believe, if I'm not mistaken, niacin can cause other side effects. It can cause flushing and things like that, but that's one that I know of. As far as blood pressure lowering herbs and vitamins, fish oil is good for cardiac health in general. And I'm trying to I'm trying to think. Vitamin C is actually good for vessel health, arteries, veins. It helps with collagen production and elasticity. Um, I was about to also say collagen because there is some back and forth about whether that has any effect because your vessels are largely, your arteries are elastic, but collagen does come into play with supporting them. But other than that, I can't off the top of my head think of anything that comes to mind, but I will look into that for you more, Tom. And I'm not sure if I don't think you've ever emailed me, but I'll put my email up in a little bit and I can let you know that way if you want to shoot me an email. Um, I know there was something that Dr. Berg had done on niacin, but I'm trying to remember if it was blood pressure or if it was cholesterol. I want to say it might have been cholesterol and decreasing atherosclerosis. Ah, happy birthday, Joyce. Um, yeah, no, I'm March 11th. So it's actually, is it? No, it's not this week. It's the following week. Wow. Okay. Let's see. Complaining to neuro about no boost after infusion. He wants lumbar MRI and more labs. Wants to look at I have something. IJK. Spike protein. That is also a really good question that I am not sure of the answer. There's been a lot of back and forth with ways to decrease the spike protein if you've been vaccinated, and I've paid attention to some of it. Can't say enough to really speak intelligently on that question. Are these the types of questions you're thinking of? There's nothing off limits here. I didn't know. I'm sure I assumed that I was going to get a lot of medical questions, but this is kind of like medical Russian roulette with me. There's some things that I'll be able to speak no problem on, and then there's others that I would probably need to really dive into what the current research is and things like that before I say anything of specific note. All right. Yeah. So, I mean, they could be, questions about me, my family, anything, really anything, hobbies, movie. We can talk about anything. There's no topic really for tonight. It's just kind of shooting from the hip. Uh, Brian, I'm a chronic pain patient for 10 years. Bad nerves. Pregabalin helps. Okay. Pain in my feet gets better when I lay down. I lift heavy flaps. Okay. I have a lot of chronic pain patients, Brian. What have you done for it aside from the pregabalin, if anything? Uh, CRPS, we have a lot of patients that get IVIG for two stimulators and spine. Okay, I'm an Android. Okay. I'm really interested to hear if the stimulators, I mean, obviously, if you have two of them, uh, are they helping you? CIDP, I haven't seen them. Check that. No, I haven't, Joyce. Hi, Anita. So when your blood pressure is low, you need, I mean, if you run chronically low, then usually with patients with like postural orthostatic tachycardia syndrome, for example, we'll have them drink water with a little bit of Himalayan salt in it. Or some people will use liquid IV. I personally cannot stand the taste of it. I I drank it once just because a lot of my patients were using that, and it is vile as far as I'm concerned. But anyway, salt can help bring up your blood pressure if it's a chronically low situation. If it just goes low periodically, then it's more or less also salt, but it's just getting to a place where you can elevate your legs and raise your blood pressure that way. Um, Low blood pressure is caused by many types of situations. So, if it's chronically low, that's usually what we'll suggest is taking some salt in your water. CBT, CBD. Okay, Crohn's. So many of you have in the past several weeks mentioned several. I think I've heard about kratom before. I guess that's how you say it, kratom. I'm gonna take a gander here. Tropical evergreen tree in Southeast Asia. Is that what that? Yeah. Says it has opioid and stimulant-like effects. Okay. Topical CBD. Yeah. Topical CBD is fantastic for so many you know, causes of chronic pain. Is for circulation, bottom of the feet, stems on the ganglion. It's like replacing one pain for another. It never blocks the pain. Yeah, I mean, I had done a video on spinal cord stimulation and TENS, and I had a mixed bag of comments with that. Many people, I would say the vast majority of them, and I only have a few patients with them that I can speak directly to, but the vast majority of my viewers with the TENS units said it worked great for them, swore by them. And then spinal cord stim, I had a lot of back and forth horror stories having to be reimplanted, infections, and things like that. So interesting, yes, that you say that, replacing one pain for another. Uh, I find I find that sometimes with a lot of these fixes, that's opioids. That's a perfect example of what opioids I view opioids as. They have their place, but very often they're masking the pain, um, and really not doing anything for the underlying cause. Topical CBD, I have a lot of people that have used that as well, family members as well. I have not had to use that yet. I still stick to my benzathymine, RALA. As far as circulation in my feet, I'll do the foot stretches, and I'll keep the spiky ball that I had in the video on the floor below my desk, and I'll roll my feet on them. Let's see. I did the 4 years. Yeah, yeah. So Anita, also, as far as the circulation in your feet goes, there are devices. They're like TENS units. I'll see if I can find what I'm talking about for you. Let's see. So you should be able to see my screen hopefully here, but these are the devices that I'm referring to. Uh, I personally don't have them, but some of them you can sit like I do with the ball, the spike ball. If you sit in a chair at a desk, and it's like a foot massager almost, and you can pop your feet in there and they'll kind of, help the circulation stay. I mean, I think this can these look somewhat expensive. I think this can be accomplished with just foot stretching and using something like a rolling ball or something like that. But yeah, let's see. Um, Mogad, are you talking about the autoimmune, the myelin oligodendrocyte? Is that what you're referring to? The autoimmune issue? RP, RP Brogue one? You're welcome, Anita. So Sleep with my shoes and that calms down the electrical buzzing. Okay. So Brian, is it like almost like a restless leg type situation? Is that what I'm getting, or is this just more of an electrical sensation in your feet that you're sleeping with shoes on? I can't imagine how uncomfortable. Yeah. Yeah. Electrical buzzing. Yeah. Optic nerve. Okay. So with the optic neuritis and transverse myelitis, um, so the MOGAD is a demyelinating condition. So I'm not sure if you know what that is, but the myelin surrounding the nerves, the body will attack it, take chunks out of it, very much like in multiple sclerosis as well. When I hear somebody has optic neuritis, I automatically think MS. So I'm not sure if that is what your friend has. Oh, thank you, Tom. Oh, oh, thank you. That's so nice, Tom. It really, thank you very much. Uh, scientific low thyroid. See. Thank you. Thanks, JK. I feel like I'm in the middle of my oral boards again for nursing school. All these medical questions firing away at me, and a lot of it I know, a lot of it I'm like somewhere in the back of my head there, is the treatment for low thyroid. Um, I mean, low thyroid is usually, I think, treated with um, is it iodine? So essential fatty acids are important with low thyroid. If I recall, beyond that, um, I'm trying to remember. I want to say there was like a specific type of nut, but anything that helps. Is it iodine? Wow, I don't. I'm gonna have to get back to you on that one, Anita. Thyroid is definitely not my area of expertise. In thyroid bed. Well, yeah, that's a good question. Levothyroxine. Okay. Yeah. The As far as what I'm seeing here, it's fatty oils like fatty essential fats like avocado, olive oil, flaxseed oil, raw unsalted nuts, sodium. Um, I'm trying to think I know there's a connection with sodium and thyroid. Let's see. Yeah. So that's kind of what I was remembering. Hypothyroid, there can be low sodium. Um, where are you? Yeah, that will attach to the thyroid. So Joyce, you can answer this question probably better than I can with this one. Um, I'm left with pins and needles and burning pain driving me nuts. Yeah. So RP, as far as the pins and needles go, what do you do? Do you supplement with anything? Do you have any other chronic conditions going on in the background, like diabetes or anything like that? And what has been suggested to you aside from, what you were talking about earlier? Um, trying to find is yeah, still. I haven't read that paper, stats if effects stat paper. 42 days. What do you think of 99 million vaccine dose, 42 days adverse effects stats paper? I haven't seen that. Let's see. Dilaudid has been the only drug that has worked on my pain. I had a bad ear infection, was in the hospital. That was nice while it lasted. Yeah, well, I mean, Dilaudid is very strong opioid, of course. And it just makes you not care about the pain. It doesn't really treat whatever's causing it, obviously. I'm sure you know that. But, you know, I mean, opioids definitely have their place. It's it's rough. It's just a rough go. Neuropathy and the burning and tingling that you get with it. It's one thing that I've said from the get-go is I could suggest a million things. They're stim, tens, all types of a lot of people are looking to amino acids, um, herbs, vitamins, dietary changes. All of it will work in some capacity. Some of it is just best practice as far as decreasing your sugar, eliminating it if you can, which is sometimes unrealistic, but the best you can to eliminate sugar. Um, the problem with neuropathy is depending on the reason for it, what's causing it. Was this post vaccine? Was this after an infection? Uh, did it crop up out of nowhere? Um, you know, all of those suggestions, some of them might work in combination with others might not do a thing for it. So I always say you need to kind of just start somewhere, try it, give it a good, month or even two, sometimes longer, and see what works. It's very elementary, but with me, with my own neuropathy, as a diabetic, when I first started getting it, and you would think that I would know exactly what to do, but it was really trial and error with me. I started with fish oil and was I think I had started with alpha lipoic acid as well. The benfotiamine didn't come until much later, and that seemed to kind of push me over the edge as far as relief goes. but I was trying all different kinds of combinations. B complex was another one. And I still do take B complex as well, but you have to be careful with the B vitamins. Um, and I just kept going until I kind of unlocked what helped me. Obviously, when I was first diagnosed, my blood sugar was well up over 600. It was so high they couldn't even measure it. So I had been walking around like that for, I'm going to say, probably 6 months. They're not quite sure. My doctors aren't quite sure how I survived that because I was dangerously high. Yeah. And once the neuropathy started kicking in for me after I got my blood sugar under control, it took a while. It was trial and error for me with what worked, what didn't. So when I suggest things, all of the things that I suggest work for me and I take them. However, in the comments, plenty of viewers will say, have you heard about this or that? And they're supplements that maybe I've heard of, but I have not personally tried. Some people will get really angry and say, well, she's suggesting this and that didn't work for me. Ignore it. Don't concern yourself with supplements. Nothing's going to work except I had somebody just the other day say, take gabapentin, that's all you'll need, and the pain will go away. And I went right into the comments and said, absolutely not. I cannot get behind that statement. I tried gabapentin, did not do a thing for me, made me super ill with the side effects. Um, so again, what worked for me might not work for you. All I can do is compile the suggestions, and we have a few videos up of the mainstream ones that I used, herbal supplements, and then emerging therapies and treatments. Let me see if I can find them. Yeah, be careful with the gabapentin. Yeah, I don't know. I'm not diabetic, honestly. I think it's pinched nerve. Okay. I woke up on day phases. Trazodone. Okay. Yeah. So I'm assuming that they're giving you RP. They're giving you something like Celebrex or Cymbalta, right? I have my reservations about that. Again, it helps some, but that seems to be a first line treatment. The Cymbalta and the gabapentin, uh, I'm I'm not too thrilled with that combination because it does not work for so many. Most of the people I've talked to, it does not work for. But here, I'm gonna share my screen again and pull up. Okay. So if you go to my channel and you come down to treating pain and neuropathy, here's the video about TENS, here's alpha lipoic acid versus benfotiamine, neuropathy breakthroughs. This was the natural neuropathy remedies. This is things like, you know, um, arnica, I think is in there. And then this is another one that I also got into different natural homeopathic type remedies. So, for those of you that are looking for additional suggestions, you can check out these two videos. Um, and then, yeah, the rest is YouTube did not like when I posted this video about psilocybin. Did not did not enjoy that. Lyrica works for you. Okay. Oh, perfect. I'm so glad. I don't know what I did. I Sometimes I think at the beginning of my live stream, I don't know if like the computer just needs to, I have no idea. No idea. But I'm glad that my voice cleared up. Initially, sometimes I always look a little warbled and I don't totally, totally. If it's not an infusion pump, I'm sure. Okay. Hi, Kavita. I talked to Kavita earlier today. So next Sunday's chronic spotlight is going to be on chronic fatigue syndrome. So that's what we're doing next week. I'm going to do a full video and overview of myalgic encephalitis slash chronic fatigue syndrome. All right. So let's see. So one of the things that I was talking to Kavita earlier today about was the rough time that she's had finding any help, finding somebody to listen to her. And that seems to be an ongoing theme with all of the chronic conditions that I talk about is people have such a hard time finding a doctor who understands their symptoms and is willing to work with you to do a workup and diagnose you. The interesting thing about chronic fatigue is that it's not really taught in medical school either. It's one of those weird conditions, like, not weird conditions. It's one of those rare, not rare either. That's more POTS. What I'm trying to say is it's one of those conditions that might be glossed over in med school, but not really focused on and taught. Uh, POTS or postural orthostatic tachycardia syndrome is yet another one of those conditions, and that is rare. The incidence is something like 1 in a million people have it. And I did also cover that, but again, not something that's really focused on at all in medical school. And, we get into practice, whether it's an NP, PA, or a physician, and you run into people with these symptoms, and it's luck of the draw, have they come across um, these patients with these symptoms yet. And if they haven't, it's it's a rough go. That's why a lot of these conditions take so long for people to get diagnosed. An illegal amount of time for people to get diagnosed with these conditions. Yeah, I have that with my CIDP. And okay. It's okay, Kavita, you're here. Do you have pets? I do. Here, let's see. No, she's sleeping behind me. I'll see if I can get her to come over. Come here, Coco. Coco, come here. Come here. Come here. Come here. Come here. Come here. Come on up. Come on. That's Coco. She is a pit bull mix, and she's about 3 years old. She's out of here. But yes, that's my company for tonight. Yes, I know, Kavita, they do need to change the name. Cindy positive for both are antibodies. I don't think it's been studied properly. Results measured via short questionnaire, not blood work. America. Yeah. Yep. Hi, Arlene. Glad you could join us. 72 positive for acetylcholine and musk. Okay, so myasthenia gravis. I'm assuming. I don't think it's been studied properly. Results measured, not blood work or physical. Yes. Okay. So for you're going on Restigio, I don't even know how to say it. Is Restigio maybe? Results measured via a short questionnaire. So they didn't do any testing on you to confirm your diagnosis or before I, but you know your musk antibodies. You know. Mhm. Complex regional pain syndrome is I I work with quite a few people. I actually have a very good friend that has CRPS, and I've seen and helped her through a lot of what she goes through. Just a puddle of tears in my lap. The pain was just absolutely heartbreaking. And it took her a very long time to get diagnosed. So, yeah, Kavita, I've never heard it called that, but I wouldn't be surprised in the least. So, I don't trust it. Where- So, Arlene, have you been on anything else for the myasthenia up to this point, or what else have you tried? Mestinon, anything like that? Azathioprine, Imuran, thymectomy. I know I have it. Okay. How did you do after your thymectomy? I'm curious. A lot of people say it's helped, but some say it helps only a little bit. Yeah. Uh, So let's see, what else can we talk about? Any additional questions from anybody? Ketamine, boy, that was fun. Didn't help the pain though. Why is the diagnosis important if there's no true help? Huh. First, Brian, ketamine infusions. Ketamine, I have to say, um, it's an impressive drug. When I was researching it, probably about a month ago now, the backstory of ketamine is wild. Um, it started as an anesthetic drug and PCP. I think it was a safer alternative to PCP if I remember. But ketamine has so much potential. It has the potential for neuroplasticity, helping the brain to kind of reboot itself. It helps with the immune response and chronic depression and suicidal ideation. But I know, again, I have plenty of people who get it for chronic pain and other various other conditions. But it's interesting that you said it didn't really do much for the your pain. I've been doing Spravato. Okay. Kavita, to answer your question, so if there's something going on that, like, chronic fatigue, and that's I'm gonna call it chronic fatigue, even though I know you don't like that terminology. For my ease of saying it, I'm gonna just call it that. But it's a really good question, and one that I can't say I have a great answer for. In terms of when somebody comes in with symptoms of any kind, in order to treat that, we need to know what it is. So that's why diagnosis is obviously important in the beginning. But there are certain conditions that I see this on repeat with, which is that the conditions are poorly understood and the treatments for them are either not well defined or there isn't a lot of evidence-based, efficacy information behind it. So it becomes this big gray area. And many physicians and nurse practitioners, when we get into those areas like that, nobody really, unless you have a tenacious provider who has a lot of patients come in with those symptoms, it's very difficult to continue to see somebody when you don't know how to treat them. That's why I get really upset when somebody comes in, or I see somebody come across my desk with idiopathic small fiber neuropathy, for example. The idiopathic part of it, my heart just sinks because it's a fancy word for saying we just don't know what's causing this. And the treatment that I know to work, which is IVIG, insurance will not pay for it if idiopathic is anywhere in the clinical documentation. It's autoimmune related, fine, we can usually get them to approve it. Idiopathic, there it's just an uphill battle. And the thing about it is if you look at these conditions, um, POTS, encephalitis, like chronic fatigue syndrome or myalgic encephalitis, even PANS or PANDAS, which is more of a pediatric encephalitis. All of these conditions, uh, IVIG helps, but they're all immune mediated, all of them. It's just either the testing is lagging behind as far as, if it's the kind of thing, I'm trying to think of a good example. Um, okay, Lyme's disease, perfect example. we make that diagnosis. Yeah, I mean, you can have the Western blot and the PCR and things like that, and you can do some blood work. You can define it, but most of the time, if somebody's way past the point where they were bitten by a tick and they have this post Lyme's disease syndrome, there's nothing that's really going to help this. And the diagnosis is made by I had a tick on me and these are my symptoms. And it's kind of a puzzle piece that the doctor has to put together. So in those types of situations, it's autoimmune. There's no question about it. But the underlying conditions that are going on, Sjogren's is another one. Uh, Autoimmune is so tricky. It is so complex because if you have one, you most likely have a couple of others, whether they're affecting your nerves or causing neuropathy, causing the myelin to be eaten away around your nerves, um, causing cardiac symptoms. Um, MS is another big one. They're not quite sure what causes it, but they've got all of these drugs and immunosuppressants to treat it. But that's what makes it so difficult. So to get around to your question, Kavita, is initially a diagnosis is important because we need to be able to know what it is in order to treat it. After that, depending on what it is, if the treatment is not well established, and more importantly, if insurance is not behind it, if there's not enough evidentiary support for it, for the treatment or the use of a particular drug, then it's just a rough go. And we could have a whole other conversation about insurance because I I fight with them 24/7. Starting tomorrow at 8:30 a.m., I will be on the phone with insurance fighting, and it's just so frustrating. I know, but 3 of them, yeah. Claims to be chemically induced plasmapheresis, but high risks. Everyone ends up at baseline. Why bother? I think I have multiple immune issues. Yeah, for some of the autoimmune disorders. Is there any research? So Joyce asked if there's any research going on for yes, there's always research going on. As a matter of fact, let me take a look uh, at clinicaltrial.gov, I think it is. Okay, so I'm going to show. So what I'm showing you here, this is clinicaltrials.gov. You can come on here, put in your condition, which again is why it's important to have an official diagnosis. And you can search by location, address, if your doctor has mentioned any types of treatments, and it will pull up here. Let me see. Not review or approve this. Okay. Let's just type in, let's see, what's one that I heard of recently? Let's just type this in, intervention treatment. Let's do that. And then you can set the radius, how far away you want to be from the main clinical site. And recruiting. So you have all studies and then the ones that are actively recruiting. So let's take a look. It'll bring up every study that is actively recruiting for myasthenia gravis. this is a great tool, and anybody who is suffering with a chronic illness, autoimmune or otherwise, I recommend that you take a look at this, and if you're open to it, see if there's maybe a clinical trial going on in your area for insurance coding yet. Clinical trial for med pain meds are hard to get due to a shortage. Really, is there a shortage currently going on of pain meds? Prednisone is the go-to for most autoimmune. Yep, that and pain medication. Yeah, prednisone. I mean, the thing about prednisone though is it's a steroid, and chronic use of steroids creates its own set of problems. That's one of the issues that I've always had, and I'm going to say something that everybody has probably said at one time or another. A lot of the times, our treatments, in Western medicine at least, our treatments cause a whole slew of other symptoms that then we give additional meds for. I have plenty of people that take prednisone and it helps, but after a certain point, uh, like they can't get off of it. It would actually be more dangerous for them to come off of the prednisone. I know people that can't have surgery because they've been on prednisone for so long. Their tissue wouldn't heal, and there's no uh, no surgeons willing to take that person on and operate because they've been on long-term use of immunosuppressants like prednisone. Hand it with three in hand. Chemically in A chemically induced plasmapheresis, Arlene. Take myself off the steroids, meaning, yeah. So, JK, as far as the nerve biopsies on your legs, did a sural nerve biopsy, I'm assuming? Um, where's in my hands? So the thing about nerve biopsies and that diagnosis, depending on the type of neuropathy you have, um, they'll do biopsies. There's two different types, and sometimes people get confused. There's an actual nerve biopsy, which is usually, let me pull it up, the sural nerve that's down by the calf. But in conditions like small fiber, we can also do a skin biopsy that is a tiny 3 millimeter little punch, and it looks at the small fibers that are more up towards the dermis of the skin. And that's why we do that. But the actual nerve biopsy is to make a formal diagnosis of something like CIDP, um, where the small fibers aren't necessarily affected. If it's in your hands, it's the kind of situation that it can eventually affect upper nerves. So if they diagnose it in your lower extremity, it's not hard to make the jump between that and the upper extremities. It's kind of like if you have it in one place, then it's not a stretch that you're going to have it in possibly the other places it affects. Small fiber, for example, can start in a length dependent manner, meaning um, the further away a nerve is from where it enters from the or exits, I should say, from the spinal cord. So the nerve in your feet, okay? The further away it is from that point and the longer that nerve is, um, that's usually the nerve that will get affected first, the further away it is. And I had talked about why this is the case in one of the videos, which I'll show in a second, but That's why. There are certain cells and proteins that go back and forth and carry the needed, you know, neurotransmitters for the health of that nerve. And as the nerve gets affected, the further away it is, the longer that nerve is. The toes and those areas are the first to show signs of a disease or a symptom of CIDP or something like that, because those nerves all the way down there are way far away from the support that they need to be healthy. So that's called the length. That's why it's length dependent. The further something is away, they're the nerves that tend to go first, and then they climb back up towards that spinal cord, and they'll have more um, they'll have more issues as it goes. So it's almost like the nerve is having problems in a backwards fashion. I'm like trying to get this out, and my brain is just not firing. The longer a nerve is, the symptoms will start at the furthest away point, and then they'll gradually work their way back up the length of that nerve, going towards the spinal cord where it initially exited. So that's what length dependence is about, and that's why it happens. So usually, if that's the case, depending on whether it's a central nervous system issue or a peripheral nervous system issue, that comes into play as well. But that's why the hands versus the feet. And I did a horrible job of explaining that just now, but let's turn on the caption. Hate to prescribe opiates. They're afraid of losing. Yeah. How do I ask my doctor for IVIG treatment for chronic Lyme? Hey, Mark, is it something they would routinely prescribe? Um, so what I would do, since you've had chronic Lyme, is I would just mention it. I would just say, look, I know IVIG has been used for chronic Lyme's. The neuropathy that comes along with it is usually what they'll get it approved for. And depending on what type of doctor you're asking, they'll probably be a little more or less receptive. So if you're seeing a rheumatologist, I don't know how much they work with IVIG, not a lot. Neurology is a little more comfortable with it because they treat a bunch of other conditions with it. Um, so I would just mention it, Mark, honestly. I can try and find some information for you specifically about Lyme's and IVIG, and I'll email it to you. Here, speaking of email, let me put my email up. So if anybody after tonight or going forward, or you watch a video and have questions, if you'd like to communicate with me directly, just email me at the email on the screen. I answer all of them, some quicker than others, depending on the week that I'm having. But, that's a really good way to get in touch with me. And this way I can focus on exactly what's going on with you. Because sometimes what happens is, even in the comments, whether it's alive or in the comments, people can only give me so much information. And it's like trying to piece together what I know to probably be a pretty complex puzzle, unless it's a very clear cut. I had this, and this is what caused it. Sometimes people will just throw symptoms at me and say, "What is this?" Or, I was told I had this, but my blood work shows this. And it's very difficult for me to piece that together sometimes. So I'll always ask you, email me. You can provide all of the information and I can ask questions. And this helps me tremendously, having that dialogue back and forth in a little little more information than I usually get. So yeah, yeah, I'll find out more information for you, Mark, and I'll send it to you. Um, and electro repeaters can be added, not so much in the nerves, especially when, yeah, yeah. Back to the opioid issue. Um, you know, I have such a problem with what we've done as far as the opioid epidemic goes. I have watched this for 30 years of, at a certain time, opioids have always had uh, an issue with prescribing. There's always been, um, it's always been a bit of a nail biter around the opioids, doctors, because of the nature of them. But throughout the course of probably, I don't know, the last 15 years, from my perspective at least, it has become, between the war on drugs, and I'm not saying that that's not real, but here's my thinking, and I might be a little politically incorrect here. You can't open a country wide up and flood the borders with cartels and fentanyl and any other number of illegal drugs, and then try and say that we're still fighting a war on drugs, and have physicians who are educated in their prescription and have a good reason to use them, not prescribe them because there's an epidemic going on. Well, yeah, there is. And the whole border issue and all of that stuff, this is only happening within the last few years. This It was going on prior to this, but man, do I have such an issue with this. The FDA is really backwards when it comes to this, and it's good that we have central reporting now where, it's harder to doctor shop and things like that for safety in terms of that. Okay. Um, but my chronic pain patients cannot get needed medication. The opioids, uh, they definitely have their place. I am not against them. And certain types of pain, opioids don't work for. Other types of pain, they're the only thing that's going to work. And, I just have such a huge issue with what's going on and how this opioid epidemic is impacting patients that actually need pain control. Never had the issue. They're making it worse, forcing people to go into illegal drugs. Yet, I'm afraid people, yeah. Okay. Wow. Okay. I'm going back up the comments. Kavita, IVIG stands for intravenous immunoglobulin. It's made from a blood or a plasma product. And the easiest way to explain it, we all have our immune systems that we build once we get sick with things and we recover. Our body forms antibodies that have a memory. So the next time we get infected, our body knows how to fight it. We also have inherited immunity when we're young. Somewhere along the way, whatever the catalyst may be, whether it's an infection or exposure to bacteria of some kind, sometimes it's a vaccine that kicks things off. There could be a million reasons. Whatever it is, it causes our immune system to go absolutely off the rails and haywire. And the body, for whatever reason, the antibodies that the body is making are altered in some way. They become abnormal in either their behavior, their ability to function, their shape sometimes, and they start attacking healthy tissue. So, this is what happens in the vast majority of autoimmune conditions. Um, IVIG is so we take whole blood donations or plasma donations and we separate off the immunoglobulin components. Immunoglobulins are just a fancy way of saying antibodies. So we take antibodies from somebody who has donated blood. We look at them under a microscope, make sure everything's normal, and then a certain amount of plasma will be shipped off to be made into IVIG, where it goes through probably a year-long process of something called fractionation. It goes through testing, purification, and in what is wound up with in the bottle is immunoglobulin G. So there's 5 different antibody types. There's IgA, IgM, IgE, IgD, and IgG. IgG is the one we're concerned about with autoimmune conditions, and that's the one that pharmaceutical companies will prepare as IVIG. When we give this to someone who has an autoimmune condition like CIDP or myasthenia gravis, myositis is another big one. Uh, POTS is another one. Sjogren's, it's also used for. When we give normal, healthy antibodies to someone, as soon as it hits the the vasculature, the body says, "Whoa, there's a bunch of additional antibodies here." It slows down your body's own production of the abnormal antibodies, and it allows the healthy antibodies that we just infused to take over. So it has a twofold um, profile. First, it's a tremendous anti inflammatory. So as soon as you get infused with IG, it greatly decreases the inflammation in your body. The other thing it does is it slows down your own production of the abnormal antibodies and it allows your body to take a breather and repair the damage that has been caused by the abnormal antibodies up to that point. So, nerves can heal themselves. Myelin sheaths can sometimes repair themselves. It depends on the condition. It depends on whether it's central nervous system, brain and spinal cord versus peripheral nerves. So that's why we'll give somebody IG, somebody with neuropathy and and small fiber neuropathy. If we give IVIG, the inflammation drops and it helps the body take a breather and repair those nerves. So if IVIG works in the case of small fiber or peripheral neuropathy or any of the other conditions I mentioned, usually they'll stay on it because it makes them feel that much better. With something like myasthenia, we'll give the IVIG almost as a rescue medication. It's also called a bridge medication. So if somebody is in a myasthenia crisis, or even Guillain-Barré is another one. If somebody is in a crisis, we will give them IG to bridge the gap until they can either have a thymectomy or get on another medication that they're going to remain on. Sometimes it'll be plasmapheresis that we'll do in combination with IVIG. There's a million variations and possibilities, but that's what IVIG does. Hi, Simi. How can I heal my back vertebrae? Have been fracturing. Also a diagnosis of Cushing's. Okay. Um, so your spinal column, your vertebrae have been fracturing. Are these compression fractures? Do you have osteoporosis? Clearly you have Cushing's disease, which absolutely doesn't help, but what care have you sought up until now? Because hearing that your vertebrae are fracturing is really concerning. Oh, climbing a ladder. Wow, Arlene, hitting my head working on a manhole. I think it triggered MG. Mm, someone told me I had idiopathic PN, and there was, yeah, yeah, the idiopathic designation. Uh, I mean, so small fiber neuropathy is a derivative of CIDP, and sometimes that's how we can get it approved. But with idiopathic, um, you know, I'm trying. Do you have any other autoimmune issues or anything in your history, that would guide you towards thinking, or uncovering what might have caused it. Idiopathic is just like me hitting a brick wall. Whenever I see that, I'm like, you know, doctors will work around the clock. Right? Dental issue. It's not, I just use the word explaining it's tainted dental. Oh, right. I'm so needed. Confused and I become worse. Ooh, donated bone. So you had it's an autograft, I believe, when you donate bone for yourself, and it didn't fuse, and I've become worse. Yeah, I mean that it sounds like you could be absolutely rejecting the graft, but my question is, how long ago did this happen? And sad, yeah, taking, no, it's okay. Yeah. Thank you, Arlene. Yeah, absolutely. Email me. The more the merrier. I love hearing from all of you and hearing about all of this. Yeah, okay, donor bone. Okay. Yeah, no, it sounds to me like it's rejecting. But what I was about to say is, where has the follow-up been? Do they do they understand this, and what are they doing about it? Hmm, time is it? I think I'm gonna end at 9:30, just giving everybody a fair warning. Gaslighting me. Yeah, gaslighting. There's a lot of that going on, and it always has gone on. Uh, that's why it takes so long to get a diagnosis half the time, is because depending on what it is, when I think of autoimmune conditions, um, unless you go to an immunologist who that's what they're all about, or Rheumatology is usually pretty good with it too. But the gaslighting that goes on because autoimmune can make a health provider shudder in their boots because autoimmune can get so complex and the issues all mesh and run into each other. And piecing them apart can be really, really difficult. But the gaslighting that goes on is something that aggravates me to no end. I think all of you, and I'll end with this, I think all of you being diagnosed with autoimmune or neuropathy, whatever the case may be, I think you would all appreciate if a doctor or an NP looked at you and said, you know what, I see your symptoms, I hear your issues, but I don't quite know what's going on, but I'm willing to work with you until we figure it out, right? I would guess that everybody would appreciate that more so than, like Kavita said earlier, take a nap, you're fine. The fatigue, you just need a nap. You don't really have anything wrong with you. I hear that a lot. And autoimmune is a huge problem when it comes to that with gaslighting. So I feel for all of you and super happy to connect with you tonight. Uh, the next live stream will be not this Sunday coming, it'll be the following. This coming Sunday, I will be doing a video for Kavita. She requested this on myalgic encephalitis chronic fatigue syndrome. So hopefully you can all watch that. Otherwise, I will talk to you all Sunday. Love you all. Good night.